Congratulations on your organ offer and welcome to MedStar Georgetown Transplant Institute. We are passionate about kidney transplantation and are excited to take this journey with you. We will prepare you for your transplant and give you an overview of what to expect. During your stay, you will be taken care of by the multidisciplinary transplant team, which includes the floor nursing staff, physical therapy, pharmacists, social workers, case managers, dietitians, nurse practitioners, physician assistants, and physicians including a transplant nephrologist and surgeon. We believe in detailed preparation and communication to give our patients the best chance for a successful surgery and hospital stay. Here is what to expect. You may wait on the floor for some period of time while the donor operation takes place. When ready, you will be taken to the pre-operative area for anesthesia to evaluate you. During the surgery, a breathing tube is placed. This is usually removed at the end of the surgery. The kidney transplant surgery takes 3 to 5 hours with anesthesia. During the surgery, a small plastic stent is placed in the transplant ureter. You will not be able to see this from the outside. In about 4 to 6 weeks, you will have a small procedure where a scope is placed into your bladder and the stent is removed. It only takes a few minutes to have this done, but it is important that the stent be removed in a timely manner. After the surgery is complete, you will be transferred to the recovery area where you will wake up from the anesthesia. Your family will receive a full update after the surgery and will be able to ask any questions they might have about your recovery. You will then be transferred to the transplant unit. A catheter placed in your bladder during surgery will remain in place for at least 3 days. This allows us to drain and monitor your urine. An IV catheter will also be placed for medications and IV fluids. You will have an incision in your lower abdomen and will have post-surgical pain. We have developed a pain management protocol that has been proven to reduce the need for opioid pain medication, both in the hospital and after discharge. Our goal is not to prevent you from taking narcotic pain medications, but to provide the most effective pain regimen for you that allows you to heal and recover while limiting the side effects of opioids. You will be asked to rate your pain on a scale of 0 to 10. 0 is no pain at all, and 10 is the worst pain imaginable. This scale will help your team know how well your pain treatment plan is working. We will be giving you some alternative medications to keep the side effects of narcotics to a minimum. Many studies have shown that patients recover faster and actually feel better the less narcotics they have to take. We ask you for a strong commitment to help your kidney last for many years. It will be important to stay active and be out of bed on your first day after surgery. The best way to know how your kidney transplant is doing is to evaluate your labs daily and monitor your urine from the catheter in your bladder. Sometimes the kidney does not work right away, and you might need dialysis support after the transplant. Usually, if this happens, the kidneys do recover in the weeks following transplant, so patients do sometimes go home requiring dialysis. Of course, if you have further questions, please ask the transplant team. You must attend a transplant class during your inpatient stay to review medications, support, and post-transplant care. You must have a support person who can attend class with you, learn about your medications, and understand the special care of a transplant patient. The average length of stay after transplant is 3 days. If you are medically ready, you will be discharged 3 days after the surgery. We ask that you monitor your vital signs and weight daily and record them in your log at home. The most important determinant on how your transplant does is usually tied to how strictly you take your immunosuppression medications. It is very important that you get into a routine where you are taking your medications at the same time every day, and that you let the transplant team know right away if you are having difficulty getting or taking your medications. After the transplant, there is a risk for infection and rejection. Thus, we will want to see you frequently after discharge. Twice per week initially, then weekly. The most common Viral bacterial infections occur within the first year and are treatable, but it could mean you have to be readmitted to the hospital. You and your family need to be prepared for these complications and have a plan in place in case of illness or readmission. Your post-kidney transplant team will communicate with you regarding your lab results and medication adjustments. We will schedule you for follow-up to be seen within a few days of discharge. Please continue to utilize the Kidney Transplant Handbook and our transplant coordinators for any questions you may have. We are committed to a full lifetime partnership with you. Thank you for allowing us to be a part of your journey. We will continue to provide you excellent care along the way.